My name is Pam Weegin. I'm the chair of the Criminal Justice Courting Council. I want to welcome you to the November 10th meeting of the Criminal Justice Courting Council. I want to pass along a bit of information regarding how we will conduct our meeting on Zoom. If visual aids are used during the meeting, the presenter will share their screen with the call. Participants and attendees will not be able to view the screen without a computer, smartphone, or tablet. All attendees will be entered into the meeting with their audio muted. Please turn on video if you have it and type your name in the box. Presenters will be unmuted when their agenda items come up. We ask that all council members and presenters use good conference call etiquette and mute their line when not speaking and identify themselves each time they speak. If you have a public comment during the public comment section of the agenda, please use the raise your hand function on Zoom and staff will call upon you and unmute you. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. The chat function has been disabled. A recording of this meeting will be available on the CJCC website after each meeting. So our first agenda item is the minutes from October 4th, which are recording. So I don't think there's any need for approval since it's a recorded item. Our second item is Chrissy Mayer from the DECA Prevention Program. Chrissy, I think you've got the screen.
Okay, good morning. My name is Chrissy Mayer and I'm with DECA. So thank you for some time today to talk a little bit about prevention initiatives happening in Douglas County. I am going to share my screen here. So bear with me for a minute while I get this going here. Sure. Okay, are you all able to see this?
Yes.
It should be a PowerPoint. You can see it though? Okay, good deal. It's saying who can share. So essentially what we're going to talk today about is just our general prevention initiatives that are occurring and then how that relates to criminal justice in the community as well, starting with our adolescents and what that long-term impact is in the community too. We're going to look at a couple of data points related to substance use and mental health, and then correlations to those delinquent behaviors, and then talk about those current prevention behaviors and how those are impacting some of those or will in the long term. That's the thing with prevention. It is a long-term investment, so it does, you won't see automatic results with prevention. It does take anywhere from 5 to 10 years to see that long-term investment come into play. So just talking about kind of where we started, a couple of years ago, we started looking at data. What we realized is in Douglas County, we did not have good data initially. So what you see on the screen right now is the most recent 2020 Kansas Communities That Care Student Survey data. And this is related specifically to laws and norms related to drug use. What you're seeing here is basically related to all substances. Youth in Douglas County don't think they'll be caught by the police if they use substances. The next slide highlights perceived availability of drugs. Kids also think there's a lot of drugs available in Douglas County. If you look at the marijuana in particular, Douglas County is one of the very few communities across the state of Kansas that marijuana is easier to get than alcohol. So that says something. We do have a lot of laws and regulations, not laws, but maybe policies related to Douglas County and the legality of marijuana that might make that perception a little bit greater. So this is an interesting data point as well. Additionally, if you think about the kids who they don't think they're going to be got by the police, they have high access. And then if you look at adult engagement as well, kids know a lot of adults who've been drunk or high, who don't think they'd be caught by their parents. So you're looking at kind of a perfect storm for all these things related to substances that are coming up. Additionally, if we look at local trends, this data is from Lawrence Municipal Court. If you look at misdemeanor possession of marijuana charges, you'll see since 2017, those charges have declined significantly. Additionally, possession of alcohol by a minor has declined as well. We did see a bit of a jump in 2018, but 2019 is significantly lower. And I imagine looking at 2020 and just the climate of 2020, we will see those enforcement rates decline even more significantly at this point. So this all puts us in a perfect storm for substances to run rampant and youth to have high access, demonstrates a definite need for prevention. Additionally, if you pair that with what our depression and suicide rates look like in the county, you'll see that this kind of targets, there's a significant number of kids who are reporting that they are depressed or having suicidal thoughts or ideation at this point. Additionally, if you look back in 2017, nearly 20% of the kids in Douglas County thought about killing themselves. That number in 2020 has dropped significantly, but that's still something to think about. So when you're tying substance use and then some of these mental health issues as well, it's a challenging time for sure. Just in general, some delinquent behaviors. One data point here I want to pull up in particular is the item with the asterisk on it. The 5.76% of youth have attacked someone with the idea of seriously hurting them. This number is significantly larger, nearly 10% for 8th grade students in Douglas County. So that is an anomaly across the state and something to be paying attention to as well. Typically our numbers are a little bit lower or right in line with the state, but that 8th grade number sticks out significantly. And the health department has pulled some data in particular related to 6th and 8th grade students as well that kind of aligns with that. So diving deeper into the data, we can see kind of when delinquent behaviors start and then the trajectory that they send youth to as well. Additionally, we conducted a few focus groups with students at the end of 2018 and beginning of 2019. We're actually in the process of revamping those and regrouping those because we're in such a different space right now. We need to hear what kids now are thinking. We can suspect that there's more free time for a lot of kids. There's easier access with the amount of alcohol or other drugs in homes and just with people being quarantined. You can see there's just kind of some different things that we need to be exploring at this point anyway. But we asked a lot of questions related to substance use and marijuana and what we were and mental health. And what we were finding was that students are really using substances to self-medicate. They think their parents and other adults aren't paying attention to what they're doing. And that demonstrates in the data as well. One point too that we were remiss in asking, we did not ask a question specifically related to suicide. However, the health department has demonstrated a great need for some suicide prevention as well, just with their suicide prevention report. I think it came out in 2019 as well. So definitely some things to be looking at. So when you look at all this data, we have a coalition called Engage Douglas County that has started looking at some of these things. Some things we've done a media campaign focused on Let's Talk About It. This is really raising awareness for adults in the community about paying attention to your kids, focusing on what they're doing and letting them know that you're paying attention to what you're doing. We've looked at this good behavior game pilot, and I'm going to highlight this a little bit more later just because there's some really interesting data as it relates to criminal justice as well related to the good behavior game. Additionally, we've looked at a couple environmental strategies related to T21. And our youth coalition actually went and spoke with Lisa Larson last week about some of the T21 aspects as well. So youth are engaging with that. Additionally, we're doing some retailer education around the T21 laws, just so that there is good information available related to what is the correct law in that regard. The schools are engaging in some school mental health learning communities. We know mental health is a huge issue in school, and so we're partnering with school districts in Iowa, Nebraska, and Missouri as well to look at some best practices related to school-based mental health services and how we can incorporate those within our own community in our own districts and really look at a comprehensive approach in Douglas County, because we know kids don't just stick to their home school. So if they're in Lawrence, they go to Eudora, they go to Baldwin. Kids in Baldwin, Eudora go to Lawrence. So kids are kids no matter where you're at. So trying to have a uniform approach to a lot of mental health issues helps as well. And then finally, we'll be beginning a Sources of Strength pilot. Sources of Strength is a suicide prevention program. We're actually doing training in Eudora tomorrow with adult advisors, and then we'll be doing a youth training next week. Additionally, we're doing some work with the College and Career Academy in Lawrence, and we have met with Lawrence High as well. So there's definitely some traction moving with that. So looking at the good behavior game pilot, this is what I think your group might find most of interest. We're currently piloting this in Baldwin City elementary classrooms. So all kindergarten through 2nd grade teachers are implementing this. There was a long-term kind of longitudinal study about kids who had this intervention as a 1st grader, and then they followed them when they were between the ages of 19 and 21. And what they found was there was significant reduction in rates of violence and criminal behavior compared to those control counterparts who didn't get the intervention. Significant reductions in substance use as well. So kind of interesting to see that something you do as a 5-year-old, 6-year-old, 7-year-old can have long-term implications on your adult trajectory and potential criminal behavior as well. Additionally, there's improved educational outcomes, improved employment outcomes, lack of need for social services later on in life. So lots of good things can come from this very low cost intervention, essentially. One thing to note, though, the prevention work we're doing is really focused on this universal approach. When you look at prevention, there are kind of 3 different tiers. There's a universal approach, which means everybody gets the intervention no matter what happens. Then you have a selective prevention approach, which means maybe some identified kids, maybe it's children of adults who are incarcerated. That could be a selective population. And then you have an indicated prevention, which those are kids who are demonstrating some problem behavior. So maybe those are kids already involved in the criminal justice system. We're not doing any interventions on that selective or indicated tier. So right now we're only doing universal, but there's definitely some benefit in looking at what we need to do for those selected and indicated populations. So I tell you all this to talk about some potential gaps that we're seeing. We don't have a broad-based prevention approach in Douglas County. Right now, what we have are pockets of activity. So as I mentioned, we have this good behavior game happening in Baldwin. We have some sources of strength, which is suicide prevention, happening in Eudora. We have some media campaign that's happening across the county. It's really important to have a comprehensive approach so we can see those long-term results, because what we're doing right now, we're not going to be reaping the most benefit of it because it's these pockets of activity. We're hoping with these pilots, we'll be able to demonstrate to some other communities that, hey, there is benefit in doing this pilot, let's expand it and get it out further. Additionally, we don't have any family-based programming. All our programming currently targets adolescents primarily, or just general population for awareness and education in that regard. So doing some family-based prevention programming is something we'd like to explore that would have greater benefit down the line. And then finally, we believe that there's some value in identifying inmates who might have children. So we could start looking at those selected interventions that we could implement for those kids to maybe change the trajectory that they may be on, so that having an incarcerated parent isn't a barrier for what they do in the future going forward. And then finally, I just want to talk kind of about the power of prevention. A lot of times we spend our money on crisis, we spend our money on incarceration, but really there's a great financial benefit for spending some dollars on prevention. As you can see on the slide, every dollar invested in prevention saves up to 18 in these other areas. And you can see this diagram shows the spending on federal programs, and these are just consequences for substance use. And you can see that there's kind of a small pocket that's allocated for prevention. And so for every dollar that's spent on managing these consequences, 1.9, almost 2 cents is spent on kind of that prevention and treatment piece, with less than a quarter of that going to prevention. So this is just something to think about. Additionally, that good behavior game that I mentioned that really does have those long-term impact on criminal justice systems later on. Basically, that cost ratio is $33 to 1. So essentially that early investment will be effective for long-term cost at this point. So that is really all I had. I just wanted to kind of give you a broad-based overview of what we're doing in prevention, things we could do better going forward, and how we could possibly coordinate with your council on getting interventions to potentially children of inmates or families as well. So that is all I have. So I will stop sharing and open it up for questions at this point.
Chris, if you could just explain the T21, you kind of referenced it in the presentation.
Sure, with the T21 piece, so last December there was kind of a federal guidance that came down saying, hey, we're moving to T21. The county did adopt T21, the city of Lawrence did not, but the federal guidance is yes, T21. And so we're just looking at educating our retailers, because there's a lot of confusion. And we work with the Kate agents at the Department of Revenue. They're the ones who do compliance checks. And what they're finding is there's just a lot of confusion on retailers about, well, do I sell to 18-year-olds or do I sell to 21-year-olds? What's the rule? What's the law? So we're really focusing on trying to do some education around that. Typically, there's a program called Reward and Reminder that actually has youth going in and doing controlled buys. That was something we had planned to do, but due to the pandemic, we're not sending kids out at this point, and that's something we would need to coordinate with the district attorney as well to have that kind of legal capability to go in and do those compliance checks. So there's some education that would need to happen with that too.
Chrissy, this is Bob. Could you say a little bit, I know we shared with the CJCC in the past, the handle with care intervention, and I know that we've made some progress in some of our communities and there's opportunity in others. So could you just give us a quick little update on where that program stands?
Sure. So the Handle with Care initiative is really an initiative between school districts and law enforcement focused on making sure that kids who have a contact with law enforcement, their schools are informed, because those kids come to school. Let's say there's a domestic violence incident outside of school hours. Maybe the kid, wasn't in custody, or the kid maybe was just saw the incident. They still might be a little shaken up. Their behavior might be out of the norm. And so what law enforcement does is they contact the school and say, hey, handle Susie with care today. Their home had an incident with law enforcement. They don't provide any additional information about what the incident was, but just they know that anyone who touches that kid then will maybe handle that child a little bit differently. So the classroom teacher, if Susie is acting out or is crying or is falling asleep at her desk, the teacher can maybe take her to the nurse and maybe react differently to her, as opposed to, thinking Susie is just acting out of, just to be defiant. So the Baldwin City Police Department actually has a great partnership with their school district, and their school resource officer does an excellent job of communicating that to their school contacts. We met probably almost a year ago, the superintendent, and Mike was on that call along with Kyle, their SRO, and we just kind of talked about process. And that's really, their process is really kind of a model for the rest of the county. And so we're in the process of looking at how we can implement that across the board. Lawrence is a little bit different just because it's so much bigger. There's some other considerations to be done. Additionally, we had some conversations with the sheriff's office about, and this came up in Baldwin, sometimes the sheriff's office will cover if, let's say, the people on Baldwin patrol have, taken someone to jail, or there needs coverage, something like that. How does that communication happen between the sheriff's office and the city PD so that information can get to the county or to the school district? So there's some work to be done, but we're definitely in process and definitely a value at this point.
Chrissy, I also know that on that program that we had on the Behavioral Health Summit, we had a presentation from the creators of this program down in West Virginia. So I'm just wondering, Mike, if one of the things we might be able to do is follow up with that and send out. Chrissy, is there still a link to the recording of that
Sure,
session?
Yep, there is.
So perhaps one of the things we could do just to bring people up to date is offer them the opportunity to take a look at that link. It was a short presentation. I think it was about 40 minutes on what's been going on there, because I think there's a lot of opportunity, again, to sort of build on the success that we've seen in Baldwin. I know Superintendent Dorothy has shared particular stories about times where this kind of approach has really made an impact, and what we could do to bring the other superintendents and police chiefs together. I'd like to be able to be as helpful as possible in that process, because I know we've gotten community feedback here in Lawrence asking, they'd heard about this program and what's the status in other communities. So I just offer that up as, if we can work with Chrissy and the Behavioral Health Coalition partners, we might be able to make some real progress on that, continue to make progress, because we've made significant progress already.
Yeah, we'll get that link and put it with the meeting summary so that all of you will have it here in the next day or two.
Are teachers who are participating in that program receiving training on trauma response, particularly around intimate partner violence, and how to acknowledge that? Or are we just trusting those teachers' intuition in those situations?
So school districts, the feedback we're getting is the school districts are receiving trauma-informed care. And there's actually the Live and Well trauma awareness training that is being offered. So yes, they are receiving support. And we've actually had schools, request some information around trauma-informed care, because you're right. Teachers didn't enter the work to be social workers. And so there is kind of a learning curve for some of that as well. So yes, the training is available and offered to those teachers too.
Thanks.
Mhm.
Chrissy, hi. I actually have a question. I'm going to go back to the gaps comment that you made, and sort of that first bullet point around a broad-based approach. Just wondering if you could say a little bit more about what that might look like. I'm wondering if are you imagining something where the pockets of activity and those programs become county-wide, or is it something where an actual plan needs to be developed? And then wondering, where does that plan sit? Who's kind of who would be the, if we lean into a broad-based approach, where does that lie, and sort of who carries it out?
Sure. So actually, we do have a plan. It's the Strategic Prevention Framework is the model that we use for our prevention planning. When I talk about broad-based approach, what we're seeing is it's difficult to get everybody on board at the same time, moving in the same direction. And so that's why we're seeing these pockets. So like in Baldwin, we're seeing that good behavior game happening. We're seeing the Handle with Care initiative happening. In Eudora, we're seeing some different things happening. In Lawrence, we're seeing other things. And then if you even look at the Perry-LeCompton school district, you're seeing other things as well. So we're not seeing this is the one intervention that everyone's doing to really move that needle on some of our things. And one thing we're finding too is there's a lack of awareness about substance use and mental health in general in the county. People are much more aware of mental health resources and challenges around mental health. Around substance use, people, there's almost an acceptance about, well, this is how it is, this is what we do. And so there's still some education that needs to be done in that regard too. So, trying to make our plan more comprehensive, I think, is a goal that I have over the next year of looking at the successes we've experienced. And the Baldwin first grade teachers actually came and spoke to our coalition about, here's what we're seeing. So they're seeing less discipline referrals. They're seeing less time lost in classroom instruction. And that's just with your littles. So will we see that continue, as kids move through elementary school? What are those long-term implications? And so that's where we're really trying to get is something really more comprehensive and bigger than just these little pilot pockets right now.
Darren, could I share one other thing, which I think is important? Because I think structurally, there's a structure that's emerging when you say, where does this work live and what's the decision-making process and how do we get to strategy, right? So that we can start to test accountability to that strategy. So we have the Behavioral Health Leadership Coalition, which is very similar to this body on the behavioral health, mental health, substance use side, right? That organization is a collective impact organization that was put in place to implement and realize the aspirations of the community health plan. We have three focus areas in that plank of the community health plan. The first is prioritize prevention. So we've actually put that top of mind in terms of our aspiration and strategy. The second piece of that is to promote integration across the system of care. So a lot of the work that we're doing with putting housing together with crisis services on a campus is an example of that sort of integration. And then the third area is improving access. So if you look at what we're doing structurally, you have this leadership coalition, CEO, COO level leadership among all 8 of the primary healthcare agencies in the community. Within that prevention area, Chrissy, DECA, they've convened Engage Douglas County, which is a much broader base of stakeholders. Many of the people on this call are members of that Engage Douglas County Coalition. All 4 superintendents participate, police chiefs participate, community members participate. And that's where the work of kind of getting to a specific plan for prevention rests. And so I think what we're trying to do on the behavioral health side is to evolve a system through which the community really can identify what the priorities are, right? And then come around and link strategy and accountability measures to test progress and to see how we're doing. all of that is kind of governed by a broad umbrella of the community health plan, and there's a behavioral health plank within that plan. There's a poverty plank within that plan. There's a housing plank within that plan. So we're really trying to align all of this work so that we have clarity as a community, and we can start to figure out sort of how to do that targeted, appropriate approach. So I don't know if that's helpful at all, but that kind of structure is something that's evolved over the last really 24 months as we started to try to implement some of these strategies. So that's new in the community, and it's still something that, you know, all the stakeholders are kind of wrestling through. Well, what is our role in this work? Who leads, and how do priorities get identified? That's where we are at the moment. I don't know if that's helpful or not.
Thanks for the overview, Bob. Chrissy, thanks so much for the presentation. I think we'll move on now to the City of Lawrence Police Assessment and consultation with City Manager Owens.
Thank you very much. It's a pleasure to be here. Thanks for the invitation, and I'll move really quickly through this because I know time is important with all we have on our agenda. I've met many of you I have not. I'm about halfway into my tenure with in a lockdown mode, so I look forward to engaging with some of you when we can move around a little more freely. But it's my pleasure to kind of walk through one of the initiatives that we're taking here. I'm going to share my screen. I hope I can do that. Nope, I can't.
Now you should be able to, Craig.
All right. Thank you. So you should be looking at Safe and Secure Lawrence Police Study. Anybody can nod. Yes, good, thanks. This is an initiative that we took. We really initiated early spring of this last year with the departure of Chief Burns. We wanted to take a look top to bottom with our police department, and obviously things that have happened since then in our world have really allowed us to a chance to really incorporate a lot of these questions and ideas about policing and security in our community into this study. So what I'd like to do is really quickly run through what we spec'd out in this, and then introduce our two consultants, two of our consultant team that are on the call, and they'll be more interesting than me on this. So this is an opportunity also to unveil a piece of our newly adopted strategic plan for the community, for the city. It is one of 5 outcomes is safe and secure. Lawrence is a community where all people feel safe and secure and have access to trusted public and community-based safety resources. So this is one of 5 things that we are, as a community, set out to do in an outcome-seeking basis. The purpose of this project was really just to look top to bottom in our police department and really engage the community and bring in consultants that can help guide the discovery process with us, with our community, what's right for our community, and also bring expertise of best practices and emerging best practices around the country for safety and security and policing. So they signed the contract, so they're committed to doing all of these things, but it's a very ambitious list. We knew that, and we think that really this is the only way, is to be really put everything on the table and get into this deeply as a community. So the scope of work was, obviously the people that are doing the work is an important piece of that. The equity is always in the way we do business and in our analysis. So we wanted to make sure that equity and to touching everybody in our community and making sure that there was those voices were incorporated into the work that we did through this study. That was a priority. Modern policing practices. So not just over the last 20 years, but over the last 20 months. What are some things that are emerging and help us tap into some of these transitions and changes that are happening and guide what's right for us here in Lawrence. CALIA accreditation is something that we had, when I arrived, it was something that I wanted to see us pursue, an international accreditation as a baseline. And I think that is something that our consultants will help us take us through. Examine staffing levels for sworn and non-sworn positions. Look at the command structure, see if there's adequate supervision and leadership. Equitable policing practices and procedural justice, things that again have taken on a much higher profile in our country recently. With the departure of the chief, this is an opportunity to really match up a profile of what we should be seeking in our most crucial leadership position in this. So the consultants will help us identify what kind of attributes will be best match for what we imagine for our policing for our department. Systems of community engagement. So how are we engaging responsive to national and local? Calls for service, alternative to calls for service. This is one, whether you're, there are different ways that we can approach our work, and you've seen a lot more attention being paid to these. I think the work that this community or this council has done has started to lead towards that, and it may suggest that there are some alternatives that we can be looking at in our community rather than sending police to every call. Hiring, training, professional development, those accountability things. How do we create a great organization that it can be successful in when we ask it to do? Data reporting systems and public reporting practices, that transparency word, but also how are we, what data are we looking at to drive decision making in our community decisions and in our departmental and leadership positions? And then finally, how the relationship with the rest of the Douglas County, just communications, the jail, booking, holding facilities, but also how we just generally interact with our other partners in the community. I'll skip ahead. I want to talk about the selection process. So although we had envisioned this work to be going out and recruiting before May, when so much of the world changed in criminal justice and law enforcement in our country, we didn't get it out on the street to the broader community. So I was a little nervous that we would be competing with a lot of cities and trying to get help with this work. And we were, but they found interest in us. So we received 10 proposals. I was hoping to get 3 or 4, and we got 10. We had multiple reviews. We engaged some community partners, a pretty extensive interview process to try and have lots of different perspectives to help make the right match amongst these. And we did day-long interviews and facilitated group discussion. So I've hired a lot of consultants over my career, and I think we probably took as much time with this as I have any that I've worked with. And all of that culminated in a selection of City Gates Associates from Folsom, California. They actually have, as you'll hear from their principal, they have resources on their team that are really around the country and bring us a lot of different innovative perspectives. I'll stop sharing. And with that, I'd like to introduce Stuart Gary with City Gates Associates, and with him is Richard Ward, who's one of his associates as well. And I'll turn it over to him.
Good morning, all of you. Pleasure to meet all of you virtually and to begin literally our first official engagement in Lawrence outside of the city staff themselves. In responsive to your time agenda limit, Richard and I want to say a few brief things, take any questions, and allow you to stay on agenda track. I appreciate Craig going over the to-do list. It's actually that and then some. The council, the mayor, the staff put about everything you could think of in law enforcement, social engagement, community, I'll broadly say health, but not in a medical clinical sense, on the table. I have a 7-person team. We have deep resumes, very diverse resumes. Some of our team members, one's located in Kansas, one's from the Twin Cities, Minnesota area. Some are California based. We've done work across the United States for a long time, and all of us have very long public safety and consulting careers. We're not academics. We're not going to bring the think tank book to this. I'd like you to remember there's kind of two big ways we're going to do the work, and Rich and I want to ask for your incipient help this morning. One is we're going to deeply review Lawrence policing as it is today. And that's an in-depth review of everything the department does, how it does it, why it does it, data-driven, listening to command and rank and file. We have to understand your as-is state. And then the second big thing is an in-depth review of how those functions and the community are relating in the as-is state. And that's going to generate a gap analysis. If community stakeholders, people receiving the services, aren't getting what they need in the form and manner they need it, we need to understand that. And then we also want to look, obviously, at this social demography changes, not just in America, but specifically to Lawrence, and what services needs are not even being met, what are being met by police officers, where that sworn peace officer time could go to other uses, and other cost-effective approaches could be blended into the program. We're going to lean heavily on the chief and the staff and the city hall staff, obviously. But Rich and I want to ask you all this morning to put on your thinking caps. As we start to network out and build interviews, it's going to be challenging to use Zoom. The city's just, the city said from their RFP forward, we just don't have the physical socially distancing space for large community in-person listening for a long time to come. So we're going to do this through one-on-one interviews, small group interviews, Zoom webinars. As we design that, if leaders like you could say, you know, I have some data, or I represent a body outside of the city of Lawrence, I might have some data and a perspective that would help the study. We want to engage with you on that. It's very, very important. I'd also like you all to think as community leaders, and everyone's going to hear this question for the next month, the first time they meet us. It's first of all difficult to do community engagement via Zoom. It is always difficult to do community engagement and find the voices that don't normally get heard, don't normally have an opportunity to speak. So if you know of community organizations, forums with leaders we could tap into, and I'm not saying the mayor, the council, and the city staff don't, but sometimes people just have a light bulb come on and say, you know, this group doesn't actually get heard very often, if at all. But I bet Pastor so-and-so at the such and such church could maybe organize something, and the church could host a Zoom conference call of affected community parties. So I want you to kind of think outside the box too. It's not just the standard list of community-based organizations and their leaders. How are we going to get the rest of the public engaged? And we're working with staff and shaping Lawrence Lessens and other internet-based tools. But every time we say we're going to use an internet-based tool, who are we by accident leaving out of the conversation physically? So that's our challenge and our work plan. Richard?
It's good morning or good afternoon. I think it's still morning there in Kansas and Lawrence. Rich Word, I'm a former police chief. These issues that Stu mentioned and that the city manager, Mr. Owens, has referred to in the RFP are issues I faced in Oakland. Excuse me, my dog. I was chief, and we faced these same issues of building trust and support and confidence in the community, hiring the right people, making sure they were trained, policies. And so we'll look at all of those issues from the academy and the hiring and the training, the supervision. I think it's key to look at the award systems, you know, how are officers awarded or rewarded and for what? I mean, that's key. Stu has said it, and I say it differently. We get what we measure. And I think that's key. What are the current measures? What do the community feel those measures should be? And certainly I suspect in most police departments, we'll find some gaps there. So I've been a chief in 3 different agencies, former president of the California Police Chiefs Association, and I've done some police procedural consulting. And then I've recently joined Citygate, and I still teach in police internal affairs, and I teach police supervisors. So I'm really excited to hear. I took note of Chrissy Meyer's, I think it's Mayor's presentation. I think I'm going to add her to our list as someone we need to speak to in terms of prevention. I found, by the way, in my experience, officers are not always fully aware of the resources available to which they can refer people they contact. And so that's something we'll look at in Lawrence to see if officers are fully aware of the resources available to them outside of the normal police resources, jail being one, to see what's available to help kids, youth, people in trouble, people in crisis. So it's my pleasure, really excited to do this work because it seems like work I've done. I've learned from what we didn't do, what we didn't measure well. And so I hope that we can help Lawrence. I'm sure we can.
Last quick comment. We're very interested in the building of alternative service delivery pathways by people with the city or other institutions. We're both going to listen to the next two updates on your agenda. We're very aware of other alternative destination transportation services programs in the United States. At the right point in time, we want to marry your data and your needs to some of those other emerging best practice programs, and maybe if necessary, have some of those program leaders host a webinar and tell a stakeholder steering committee and some of the Lawrence staff about what's working, not working in their emerging program. I also found it really beneficial that one of you earlier on the youth issues mentioned the framework and the fact that you can have a great idea, but implementation takes a lot of detail. And we want to leave you with enough of a data-driven environment to build a business case that if you put funding here, it's going to really produce results. Or you desire to put funding here, but it's going to take you 9 steps and a new framework of engagements, rules, procedures, and a different type of trained staff to deliver it. So, examples of that right now, currently Riley, Kansas County, they have an alternative receiver site. You just can't say, well, I want someone different to respond to the 911 call. But what do they do with the party that needs non-law enforcement help? They have to go somewhere in many cases. You have to build the receiving center. The Cahoots program in Oregon is a 501c3. Is that economically stable forever? Do you want to depend on a nonprofit to do it? And do they have the economic legs to service the population that way? Los Angeles County right now is rolling out a totally different mental social health program, and it's with one-time funding. So we want to also help you all understand you have the need and then the economics and how do we marry those up with all of you as local stakeholders. And with that, I'm a minute over your agenda time. Thanks very much for listening.
Do we have any questions from the council?
I would just say I would really appreciate the update, and and just from the county's perspective, we just really excited to stay engaged in this work. And if there's this whole group, this council's entire purpose is to coordinate this work from a community-wide perspective and a county-wide perspective. So if there's any way that this group can be of assistance, please let us know.
Thanks, we appreciate that. And as I work with the chief and the staff and Craig's team, we're just now building that framework of contact lists and names and into that framework, whether we reach out to you individually, reach out to you as a small team, you introduce us to somebody else with a small team. The networking growth of this research, we're just now in the design phase. The police department has our background document request. We've also made a large electronic incident data request. We're going to build the social outreach tools before Thanksgiving, and we hope to start with City Hall-centric police leadership interviews in early December. Given the holiday schedule, I will admit today, I don't know how much community social outreach will get done before the holidays, or if we decide to not let that distract and we hit it hard right after New Year's. So the community-based listening is still a work in progress as we design it.
Thank you very much for the presentation. It's very helpful. And moving on to our next item, it's Bob Transky with the Mobile Response Project.
Thanks, Pam. what I want to do in a very short period of time, this meeting, is to try to give you a little bit of preview of conversations that we need to have, I think, next meeting and moving on. And again, just really re-emphasizing the work that the Behavioral Health Leadership Coalition is doing is to try to create this framework for strategy and how we should move forward. In a lot of ways, what's been happening in this community is the result of the community saying we want better solutions. And, last Friday, we cut the ribbon on the permanent supportive housing that's on the treatment and recovery campus. 2 Fridays from now, or 2 Fridays from then, we'll cut the ribbon on transitions, which will be, transitional housing for 12 people and 2 crisis beds in this community that'll be available 24/7 that haven't been available before. Friday before that, or 2 Fridays before that, we broke ground on the crisis center. So this community has moved and made a lot of progress in a short period of time on putting those resources and facilities in place that can improve our behavioral health system of care. But the thing that we've learned is that, a crisis center is not a magic bullet. A crisis center is an alternative facility to the emergency room and the jail. A prevention strategy is not going to change the community by itself. All of these things have to be integrated. And one of the critical pieces in a crisis system, or critical components, are an integrated 24/7 crisis line that is linked to law enforcement, EMS, and alternative responses in the form of a mobile crisis response team. So I think it was around January, Mike, that the CJCC said we're going to convene a work group and we're going to sort of start to drill down on a plan for mobile response. And we've kind of tried to pull the CJCC's members together with the BHLCs, all these LCs members. And we started in January and COVID hit in March. And we are just getting our feet back, I think, on the ground as a work group. But there's been a lot of work that's been done. What I want to share with you right now is just a very quick overview of what we're talking about when we say expand mobile response in this community. Because meeting people where they are before they get to a crisis center, or before they need a crisis center, or before they show up on the weekend in the emergency room because our crisis system is not open from Friday at 5 o'clock till Monday at 8 o'clock. This is another critical component that we need to put in place, and it's a complicated piece to figure out. It's certainly doable. Communities all over the country, as Stu was just saying, are doing it. So there are models. We have experts involved in what we're doing with the campus, and from Connections Health Solutions out in Arizona. They've built crisis centers all over the country. So we have this type of expertise on board with us, and we have one of the people that's really been a leader in writing about crisis centers and mobile response teams as a part of that. Dr. Balfour suggested that I share with you this afternoon a short little video that was put together, and I am going to need sharing.
I've got it. Do you want me to play it?
Huh?
I've got it. Do you want me to?
Yeah, why don't you play it, Mike? We can't hear it.
Oh, all right.
So when you choose sharing, there's a box on the bottom at the left that says share video, and there are 2 boxes on the bottom of that share screen form. If you let me share, I've got it too.
Yeah, you should have access, Bob.
I have access. Let me hit those 2 buttons, share my screen.
Yeah, go ahead.
Look at us, we're backing each other up.
That a fire breaks out in your home. And in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system made up of elements designed for other purposes that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20 to 25,000 individuals in crisis go to emergency departments every day in the US. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems, like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs. Call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.
Just want to make sure we don't get an ad for something else playing in the background here. So that's, again, just to give you an overview. And Dr. Balfour recently had an article that is going to be published by SAMHSA, the Substance Abuse Mental Health Administration, that we will send as a follow-up, and some, and see, I did my best. Sorry about that. I don't even know if you heard that or I was the only person who was hearing that. Zoom is.
We are not, Bob.
We didn't hear
Okay.
you. Well,
All right. Well, I heard an ad from Beatrice, so I apologize for that. But this work group has a broad coalition of stakeholders, all of our behavioral health leadership coalition partners, Burton Ash, DECA, the hospital. Headquarters is involved in these conversations. Dispatch is involved in these conversations. I'm not hitting all of the boxes, but we've spent quite a bit of time assembling that stakeholder group. They meet monthly. We have some smaller subgroups that are having conversations to get to specifics. The goal is that in March of 2021, we will have a more comprehensive plan, our proposal, let's put it that way, that's been shaped by all of the key stakeholders, and the components of this have been vetted by that, so that we can, as the county starts to move through its budget process for 2021, we could be ready in 2022 for as the crisis center opens, to have this component in place as well. That's going to require some real work on our part, and probably we are going to want to pilot a component of this in 2021, or there might be opportunity to take a small step forward. Just want to end with just one thought that I think is really important in this group, because it's been strongly communicated to us by the stakeholders in our group. And that is that there's been a lot of conversation about finding appropriate alternatives to having law enforcement and EMS respond. And we need alternatives, but those alternatives need to build upon what already exists, which might also need to be expanded. You cannot replace what's in place already with the co-responder unit and with some of the other interventions in the community. You cannot replace that with a mobile crisis response team. You can sequence things more effectively so that law enforcement are not called out prematurely or when they're not needed. But if you talk to anybody that would be part of a mobile crisis response team, when somebody is in a crisis, the public safety dimensions of that situation, the care and complexity of that situation requires that you have all the right options in place. So I just think it's really important for this group and the stakeholders in this group to keep that in mind, because that is very much a message that our group of stakeholders wants to communicate. We are not talking about replacing one with the other. It's not an either or, it's a both and type of proposition, and it needs to be a both and conversation moving forward. And we also can't dismiss the fact that there's been tremendous work on our law enforcement EMS side of this equation. We have more CIT trained officers in this community than most communities around the country. And so, we are making progress that when law enforcement emergency first responder shows up on the scene of a crisis or an emergency, that they are prepared to be sensitive, compassionate, and really understand some of the complexity of the people that are in a moment in time that's a real crisis.
Could I ask a quick question of Bob?
Sure.
Absolutely.
Chief, if you could be the gateway to get Citygate everyone's name and email on this meeting, first of all. But Bob, in particular, I'd like to follow up with you. I'm really pleased to hear what I just heard. And for Craig, the chief and the mayor, as you know, I have a strong background also in EMS and alternative system design. And Bob, I also speak EMS economics. So I'm not saying you need another consultant, but just I will listen to you at the pace you can download it and understand it, and then also perhaps be able to relate some experiences from elsewhere in the country. So I just heard enough to know you've got, as a community, some really great building blocks underway, and I want to deeply understand that and integrate it and leverage it as we go through the study.
I appreciate that. And I just also want to, this really started with Patrick Schmitz and Kevin Joels and Mike Brower saying we need to get this work group going. So I want to acknowledge the work that our stakeholders have done, and, and the cooperation that's been involved. We've now brought Heartland Radak into that sort of integrated approach to looking at that. So I look forward to following up and connecting you with, the members of our team also, because I think we've done a lot of work. I'm not sure we've done a lot of learning or synthesis of what we've learned through this work, because we've been moving pretty quickly in what's really been about a 20-month time period, which is not a long time in this type of project.
Bob, I was wondering, and I'm just trying to play a little bit of catch up. If you could sort of map, and maybe this may be too early to ask, but if you could map Douglas County onto the video, thinking about sort of those three pillars that are there, I'm wondering right now what you think, or what the work group is finding to be top priority. I mean, the crisis centers are opening or about to open, as you pointed out. I'm sort of wondering, is it something where, you're saying it's that network connecting the crisis line and the mobile response unit and the crisis centers, that's where the focus needs to be? Is there one of those pillars that needs to be, that you're like, this needs to be looked at a lot more closely? So I'm thinking, noticing what Crisis Network has put together here, just trying to figure out where the priorities are for us within.
So I would say that Proposition 1 is about all three of these priorities. We have done a lot of work to do the third pillar, and by December of 2021, that facility, which will be new, which will be open 24/7, will be brought online. We're working with the integrated crisis team, Burt Nash's Access Center, to extend hours so that the hours go till 8 o'clock during the week instead of just till 5 o'clock. We've bolstered access to psychiatry and care coordination. So all of those pieces on the right-hand side, in terms of being better prepared to support people in crisis, that's what's been done under those two pillars. The left side, not a lot there in this community. Although there's the co-responder unit, which Lawrence stood up several years ago, but that is not, a mobile outreach team as described in this video. And I think the big piece in terms of system is we need an air traffic control system, right, for coordinating the resources that exist and new resources that we bring online. If 911 dispatches law enforcement or first responder firm via EFS, we need to be able to tap into that or have a better way to refer to that so that people have another, and when they pick up the phone and they don't want law enforcement to come because they know they don't need it yet, who do you call? You need to call somebody else other than 911. So we don't have these two pieces in place, which is why there's so much work to be done here. And to answer your question is, where are you at this point? Data, data, data. What is the data telling us about where the needs are, and how do we pull that data together so we can respond countywide, right? This is not just a Lawrence challenge. This is a Baldwin, Eudora, Lecompton, and Lawrence challenge. So the good news is, through all the work that's been done, there's tremendous relationship building that's happened. We're communicating across agencies better than we ever have before, and COVID is challenging us to respond to need faster than we ever have before. So there's a lot of learning and growth going on.
I'll just add to that is every agency that's involved in this work group, the BHLC, the Stepping Up Initiative work group, the CIT Council, they all want to do each one of these well. But figuring out that, as Bob says, the sequence to create this continuum of crisis care is where we're working at. And we all, based on our own experiences, have ideas, but we want to make sure that the data matches up with our own ideas as we work as a team to move forward.
Do we have any more questions from the council? Bob, thanks so much for the update. It was very helpful, very informative. Our next presentation is an update about the Racial and Ethnic Disparities Work Group from Mayor Jennifer Ananda.
Thanks. So I think I will be relatively brief in this update. As you can imagine, after our last meeting, we are drenched in data. Currently, we're looking at several items: failure to appear warrants. We're looking at bond. We're looking at the type, the amount, and the length of stay as a result of that. Felony charges, pleas, and sentences. So each piece of that process. And then the GIS mapping that was mentioned last time, of arrest by census block and race. So as you can imagine, as we dig into this data, we have more questions, I think, than answers at this point, because we're still very freshly into that data gathering, and Matt has been doing a phenomenal job of bringing that to us. We're seeing that, we see the impact on race, or based on race, at each point of the system as we've been looking at it so far. Those are small impacts at each step, but cumulatively those add up. And I think that, that's a pretty important piece of this conversation, is that we're not going to find the answer, the data point that impacts this, but it's really an acknowledgement that this is a cumulative process. So we're walking back to understand where this starts. So as the CJCC requested, we're looking at the system function by creating a map as well. We're using the Bureau of Justice Statistics map, and it's going to show each of the decision points in our system, who are the decision makers at each point, what decisions are available at each point, what data is then collected to analyze each point, and then look at emerging practices that can improve each point. So that is kind of a summary of where the work group is right now, based on the conversation that we had. And that's kind of all I have. So if anybody has any questions, happy to let Matt answer those. Thanks.
Thank you, Jennifer. Our last item is the correctional facility update from Captain Bunting. Is that right, Gary?
Yep, I'm here. I'll be real brief. There hasn't been a real difference since the last time I reported. Probably for the last 7 months, our numbers, overall average population each month has been anywhere from 137 to 150. Our out of county housing population has been down. Presently, we have about 12 individuals housed in other counties. KDOC is slowly accepting individuals for transfer. Some of our mental health facilities, such as Osawatomie and Larned, continue to have significant delays. Just for one example, we have one individual presently who has been ordered to Larned. That individual has been waiting since January 30th. So we've had significant delays there. We're still in COVID prevention mode. So even though we have 186 beds, we're under normal circumstances, we're functionally full at 167. That's even less now to be able to help provide for quarantine and isolation settings. Aside from that, if there's any questions, I'll be happy to try to answer those.
Gary, just to fill in that last piece, this is Sarah. So with the COVID prevention measures, we're functionally full now is around 150, 155, correct?
Yeah, probably approximately 150 is more accurate.
Thank you.
Thanks for the update. I don't see more questions. At the bottom of the agenda, we have some proposed 2021 meeting dates. Please hold those on your calendar. If you have any conflicts, please let Mike know what your conflicts are with those dates that were proposed. Our next meeting is going to be on December 12th for the implicit bias training from 9 to 3. And I think we'll be getting a link from Mike at some point in the future for that meeting. Do we have any public comment or suggestions, things that we need to take up? I don't see anything in the box, in the chat box. Do you, Mike?
No, I don't see anything.
Okay. Do we have anything else for the good of the order today that we need to discuss? Seeing none, I'm going to adjourn. Thank you very much for attending.